Welcome to the Improving Rehabilitation Services community of practice. Today we're discussing what it takes to get it right for young people as they move from children's to adults' rehabilitation services. What are the actions and the context that helps? The webinar will last 45 minutes and we will welcome your feedback through the evaluation that will come up at the end of the webinar if you're listening to us live. A bit of housekeeping before we get started. As you look at your screens, you will see only your name and the list of panelists in the list of participants. However, we know many others are online. We've had about 80 people register to join us today, and people are coming online as we speak. So welcome to you all. If you experience any technical difficulties, then please use the chat button on the webinar software. You'll see it on the top right-hand side to send an instant message to Kaylee Mayetta. You can do that at any time during the live event. This webinar is being recorded and will go online with the slides about a week after the event, and I'll give you the link to keep an eye out for that later. So we're focusing on rehabilitation services as defined in the recent commissioning guidance from NHS England. Those services which enable young people to maximise their potential, to live full and active lives, and which use personalised, interactive and collaborative processes reflecting the whole person. If you haven't yet seen this guidance, which can be applied across the whole life course for people who may be, for example, developing skills for the first time, to those recovering after illness or trauma or managing a long-term condition, then this guidance is available as an online resource, which you can find via this link. Welcome to our speakers today. We have Ganeshamoorthy, Dr. Nick Wilkinson and Julia Smith. And I'm Dawn Smith and I'm the chair of the webinar today. Our speakers are here to share their own experiences of either having moved from children's to adult services or having supported young people as they move from one service to another. What they're not doing is presenting definitive answers. Each speaker is going to be talking from their own experience, so I'm going to invite them now, and perhaps starting with Tinez, to tell us in a nutshell what that experience is. Tinez, tell us about your experience.
Yes, thank you, Dawn. I'm 22 and I'm currently a student at university, and I've experienced a range of transition services from education to social care to medical, and what I've seen is going from a large plethora of services which have been available during paediatric services, I've seen it dwindle away into pretty much nothing in adult services. So I'm here to sort of share that experience with you and what I've learned while transitioning.
Thank you very much, Tinez. Nick, tell the listeners what experience you're bringing to the conversation.
My experience is from setting up and delivering services initially in Oxford for the South Central region, and then at the Evelina for South London and South East Coastal region, and both presented different opportunities and challenges. And then I've also been fortunate enough to be engaged in strategy, teaching and research. In Oxford, we set up a service for those aged 12 through to 23. In London, we've had a different opportunity. We've set up service from 12 through to 17 and 17 through to 23. Again, thinking about the size of the region that we have to support.
Lovely, thank you. And Julia, just to complete the picture.
Thanks, Dawn. I'm a specialist paediatric physiotherapist, and I work at the in Oxford, specifically with young adults and children with rheumatology conditions or chronic pain, and I've supported many adolescents from paediatric services through to adult services, both in education and in health as well.
Lovely. Thank you to all of our speakers. We won't be having a live Q&A session today. As you've just heard, our speakers represent a range of experiences, but we know that there will be listeners out there with other broader experiences as well. And so we really want to encourage you to share your own thoughts, your learning, your experience via the Community of Practices online forum. And you'll see the link for, this is the first link that you'll see on this slide here. There is also a guide to help you post information on the forum in the second link underneath. If you're listening to the webinar and you want to tweet information, then please tweet us at NHSCSI and use the hashtag either hashtag rehab or hashtag rehab improvers. So I'm going to start asking Tinez to tell us a little bit more about his experience. And I met Tinez earlier, and when we spoke, you told me how issues of timing, planning and communication can make the transition from children's to adult services feel like you're rather marginal to the process. And you also used a very striking phrase for me. You told me that it could feel a bit like being thrown off a cliff. Tell us, first of all, if you have had such an experience, when you have felt at the heart of this process, what specifically did that look like? Can you give us a real-life experience?
Yes, of course, Dawn. An example I would care to use is something I experienced at my local hospital with my paediatrician at the time. At that point, when I was going through transition, I was about 16 years old, and he was starting to take me through the whole process of transition and showing me what the steps that would need to be taken in order for me to be transitioned onto his adult counterpart. At that point in time, he allowed me to meet with the adult physician. He allowed me to have trips to the adult ward so I could see what the atmosphere was like, and he allowed me to join in on the meetings that they were having jointly so I could be comfortable with speaking with both of them together and also with the adult physician separately. So that was really useful for me.
I can really see there then how that sense of timing, pacing is being illustrated by that example. What difference did that make to you?
I think it made a world of difference to me, really. It sort of gave me initially the confidence to be able to voice my opinions with my adult physician, because I had a very comfortable relationship with my paediatrician. So this allowed me to have confidence, allowed me to take control of what I was doing in terms of adult care, because I needed that, and to feel like as I was progressing in age, I was actually being in control of my own healthcare and my requirements, my needs. And it also gave me the ability to sort of be very expressive with them as well and feel comfortable.
So that sense of pacing, timing, the building of relationships, I'm hearing that the impact on you as a person using the services is one of greater comfort, confidence and control. Let's look at the other side of that coin now. If you can draw upon any experiences where you were much more marginal to the process, what was the impact then upon you?
At that time, I was really feeling like I wasn't important in the whole process. I felt that I was being sort of just a very little pawn in this whole game of things, and I was just being moved from one place to another without really being involved in it. I felt a lack of control. Mm-hmm. I felt a lack of safety because I wasn't really sure where to turn to, and I felt sort of a lack of coordination between the services. So I often felt that I wasn't really being heard or listened to, and that was really damaging to me at that time because I was going through a lot of other things at that time as well.
Okay, so coming back to your original point, that often making a move from children's to adults healthcare is happening at a time in your life where many other changes are happening as well.
Definitely.
In education, in social relationships, and that the impact of that is quite significant. Let's go to this phrase, please stop throwing me off the cliff. Mm-hmm. When you ask for that, what are you asking people to do?
Yes, definitely. I can illustrate this with quite a nice example, if I may. When I was 18, I went to see my paediatric physiotherapist, and at that point I was expecting a normal general checkup with my physio, and I went, and the appointment went without any consequences, and at the end of it my physio just said, well, goodbye, this will be the last time we see you. We will put your referral through to the adult services, and they may or may not choose to get back to you depending on if you meet the criteria. And that's what I mean by stop throwing me off the cliff, where you sort of take me to an appointment, say this is the last one, we don't know what your future is with adult services, we won't know if they take you, and then you sort of leave me feeling like, well, what do I do next? If I need something, do I just sort of hang there and wait for someone to get in touch with me, or are you going to give me some direction or some signposting to where I need to go if I need that support?
So this was significantly different to that sense of confidence, control, feeling safe. But also, was this a service that was central to your care?
I would say definitely. Physiotherapy and other social care services are very central to my condition because I need it day to day. And the fact that I was losing this meant that when I was, needing these support, I wasn't getting it because by the time I would find out who I needed to contact, it was far too late and the issue had passed and I was being further damaged by this. So it was, yes, it was very hurtful not to have the support.
Thank you, Tinez, then, for sharing those experiences. I want to just come back to another thing that you spoke to me about, which was a belief that you really would like to change, and that belief being that transition happens, I think your last example illustrates this, at one specific date and time. Tell me more about this.
Well, transition shouldn't happen at a specific age. It should happen when the young person is ready for it, and it should be began at an earlier stage in your life, like 14, 15, so you have a chance to get acclimatized to what is going to be happening, so you feel more in control and you feel more safe in the processes that will be taking place. So I think that's what needs to happen, because when it doesn't happen, you sort of feel like you're sort of losing control, you're sort of being pushed off the cliff, and you're sort of not being supported. So that's the importance of why transition shouldn't happen at one specific time in your life course. It should be built upon gradually.
So for you, in your experience, and Tinez, if we just let the listeners know, obviously your experience is having had identified health needs from a very early age, then for you, your preference would be to start that process of starting to plan, starting to pace, before age of 18, and having a much smoother process with a longer duration.
Yes, almost definitely.
Yeah. Okay, thank you very much. Okay, so I'm now going to bring our two service providers into the conversation, having heard both your experience, Tinez, and obviously they're bringing their own experiences to bear as well. Looking at this slide here, and I think Tinez has already touched on this, we're talking about age-appropriate or developmentally appropriate care and getting that right. But I'm interested to ask, I think Nick will ask you this, what do you mean specifically that if we get this right, we'll get it right for all and not just for regular users of healthcare services?
The consideration of transition is that movement from paediatric services to adult services, but we can't always control that, and some patients will move on to adult services that are beyond our hospital, within perhaps the network, or even remotely. And so we have to understand that those young people are going to make that move, and so how do we set them up with the right skills so that they cope very well moving into the new service? But also, there's lots of work that's been done, and excellent work that's been done on looking at those with long-term conditions. But what we mustn't forget is that people who have suddenly entered into the service through a catastrophic event or through sudden onset of a long-term illness, say at 18 or 19, that they have exactly the same needs, and those needs shouldn't be forgotten. So they're going to be making the same transition into university, living at home, making new contacts socially.
So what I'm hearing you describe then is that, well, as Tinez has already set out, this is a process that may happen at different times for different people.
Yes.
It isn't the prerogative of child development centres to be planning for 16 to 18. This is a process, transition is a process that people may go through at different times of life, and that if we're being patient-centred and we're offering age-appropriate or developmentally appropriate care, then that is the first step in getting this right.
Yes, so Tinez talked about pacing through this, and so we start our young person's preparation from the age of 12, and even younger than that, we'll invite young people into a clinic on their own, so they can start to take their ownership and ask the questions that matter to them at that point, and not wait until they're 16 or then have moved on. So that process is a process that's gradual. It needs experience, and we support that.
Okay, thank you. I'm going to turn to Julia now and ask Julia, when you're putting the young person at the heart of this process of transition from one service to another, what specifically is happening? What does that look like?
It's taking into consideration that individual's needs and where they are in their life at that time. I've got an example of when I treated an 18-year-old girl who was, triage really due to her date of birth. So she was triaged into an adult service and was sort of seen in the adult service, but actually felt that due to things that had happened to her early in her life, she was unable to cope in that adult setting. So therefore we brought her back to a paediatric setting and treated her where care was sort of more one-to-one, and she was the focus of the treatment rather than being in big groups where she felt very uncomfortable. And that young girl managed to sort of achieve all the goals she wanted to achieve and got back to where she wanted to be.
So I'm hearing from you all then that providing this age-appropriate care or developmentally appropriate care that has the person needs at the centres very much has outcomes in terms of user experience and clinical outcomes, and outcomes of effectiveness. What we're hearing is many services feel the drive of process, that there are criteria, there are thresholds on ages that actually tip people into making that transition process. So what, in your view, are the benefits of age-appropriate care, both for the providers of services and for commissioners of services? Why should people bother? Nick, do you want to pick this up?
Talking generally without maybe thinking about a direct case, the benefit of working relationship between provider and the young person. There's been a lot of data that's shown that that young people feel as though they're not fitting, that the treatments are projected onto them, and if you get it right with communication, then adherence is much better. And I had a recent case that was along the lines of that, where the young person sat behind his parents, didn't want to take the treatments, didn't really want to engage, and so we just moved the chairs around, sat the parents behind the young person, and started just talking to the young person and asking the parents just to consider what that young person was going to say. And then within a year, we've got treatment perfect. He's now playing football again, which he very much wanted to do, and that was just changing. So the adherence was much better because he realised what was needed. If we get it right at the start, then the working relationship then only develops and blossoms. And then the other thing that we've got to remember is that with young people, we're setting some of the health-seeking behaviours. And if we get that right, then that will be right then for the life course.
That's lovely, thank you. So I'm hearing that investing in the transition process and the relationship building, the communications, the pacing that we heard Tanez describe, actually, if we were to look at other outcomes, we're getting outcomes of efficiency, getting outcomes of effectiveness, and actually investing for the future in that individual who is likely to be a long-term user of services.
Yes.
Let me turn to you both again and ask you, has anything, you've talked to us about the positive things you've been able to do, has anything ever stopped you from providing age-appropriate care? And I don't think if it has that you'll be alone. I'm sure all of our listeners will be able to come up with examples where they feel there are barriers or things preventing them from providing this.
I mean, from a therapy point of view, we know that there are times when it's difficult to get children engaged in exercise, especially the sort of cohort of people I see, which are people that are in pain and sort of don't necessarily want to exercise. So we've looked at getting children immersed in exercise by using sort of specific gym equipment. We tried using this in our little gym and realised actually this was a really effective way of getting children engaged in exercise. So we did a fundraising event where we raised a lot of money to get some innovative kit, which was some gym equipment with sort of computer screens to engage these children. And we wanted to use this gym equipment in a room that was no longer being used on a ward. And we faced barriers of not being able to necessarily access that room because of wanting to be allocated to somebody else.
The hospital had worked out that their needs were to have more adult activity to make the service financially sustainable, and it sort of missed the point that the paediatric service wasn't able to access that room to get large populations of patients who were missing school through into effective care, and this is one of the principal areas of engagement. So there was the challenge of what the institution felt was their needs versus what we identified as being the young person's needs.
And I think those challenges always exist, and all those needs are valid. How, in particular, did you work your way through that in this case? Was there anything that enabled you to put that innovation into place?
I think one thing was just sheer stubbornness.
Okay.
The other is using individual cases to inform business cases. Yeah. We're all human. We get to understand the human dimension. And so there was one case of a young person, I think 15, 16, who couldn't was only at school 40% of the time because of chronic pain, We couldn't provide the right MDT support because of lack of resources. We had lots of other young people who had similar needs, and she was on a waiting list coming through. And I just thought, well, look, it's been so long now and she's still not had treatment. Then I was down at a sports and exercise medicine clinic that I did at the same time. There were 2 surgeons in the room for one patient who was at Oxford University, and it was during the marathon that they were getting significant pain, and they realised that they had this new condition and they could offer a new operation. And this was just flagged through. And so there was that different institutional understanding of what was going on and what was achievable. So I presented that to the chief executive, which was very much understood, this challenge, and that helped unblock then the business case development, and for us then to continue with our service development.
Lovely, thank you. Okay, so we have compiled, between our speakers today and ourselves, we've brought together some resources for listeners. Now, you won't be able to see these very well on the slides in front of you, so the slide set will be available online, so keep your eye on the forum to see when that's available. These resources are a compilation of both evidence of quality and effectiveness and the case for age-appropriate care, as well as some other resources which are particularly focused on the transition process itself. And we would very much encourage you listening, if you have other resources that you are aware of, then please do post them on the forum and share that knowledge and that learning across the community of practice. Can we go back a slide and ask, of these resources, are there any that our speakers would like to recommend in particular to the listeners?
Well, I would particularly like to recommend the first paper, Melinda Edwards and the young people that she worked with, where they used various tools, including the 15 steps and your welcome quality criteria, which were the next 2 references, to say, well, what is it as young people we would want from all services? And I think there's a really good methodology, and it really states where the young person comes from, and then what they think are the key criteria by which to evaluate a good young person service.
Thank you. I want to come back to Nez now, remembering that when we spoke, and I think the stories have established this already, but I'd like to get some more detail on this. You told me how important communication is to you in this process. Tell us a little bit more about what communication you found most helpful.
I think the communication style that I find to be the most helpful is one that is accessible and is considerate of the age that they're speaking to, because I think that allows the professional to sort of engage with the young person according to their understanding and cognition level. And I feel if you're going to be patronizing, then it doesn't really engage me very well.
Okay. And what kind of communication is the least helpful, if you can draw on, particular experiences?
An example of when communication sort of broke down between myself and a physician was I went to an adult appointment a couple of months ago, and I went in and the doctor was very patronizing. He spoke very quickly, didn't really give me an opportunity to question him, and I found that to be rather ineffective because I didn't feel that there was two-way dialogue. It was just him talking at me as opposed to there being a communication between the two of us. So I felt that to be really unhelpful and really put a barrier in between what I was trying to get through to him and what he was trying to get out of me, which was try and get me out of the room as quickly as possible.
What's striking me is if we think about within this community of practice, many of our listeners will be aware of the principles of good rehabilitation that have been developed, and that's the guidance that sits in the commissioning guidance. And my hunch is that your ask and your story, Tinez, is not peculiar to young people. That people with rehabilitation needs are very much identifying that they need to be central to the process and need to have that communication really focused around them, their life and their needs. One thing that we hear a lot about is the issue of the service user and the young person becoming their own advocate and enabling people to be their own advocate. Can you tell me what, if anything, can block you from being your own advocate?
I think there's a variety of things. Even as someone like myself who's been involved in healthcare and all of these things for a number of years, I still feel it rather difficult to be my own advocate because of the fact that I don't get to see the same people, especially in adult services. And that means that it really doesn't allow me to build up that sort of trust in that relationship, and that really blocks me from being my own advocate because I'm too nervous or too frightened to say anything because everyone is sort of new and I don't really know what kind of style of person they are, and that really blocks me from getting my own case across. So I think that it's just the fact that the system of adult services is rather a more challenging minefield than paediatric services, which I'm used to.
It would be interesting, and again, I put this out to our audience for comments as to I wonder how many 40 and 50-year-olds feel confident and that they have a good relationship if they see a different person each time they attend an appointment. So it's an interesting point that you make. If there was one thing that clinicians or service providers could do to build communications with you, what would that be?
I think it would be to work with me directly and ask me what works for me and what works with them, because I think that having a co-joined way of working and a co-joined relationship is the best way forward in trying to make things work for the both parties that are involved in this.
Yeah, lovely. Okay, so with that in mind, I'm going to now turn to our service providers and ask you in your service. Now, we've got a slide here which you've entitled a framework for evaluating services. Nick, perhaps you can tell us a little bit more about this, and then I'll ask you to, against these headlines as it were, tell us a little bit about how in your services you've been able to provide that communication and reassurance that Tanez has started to describe that he needs.
That's quite a big ask. So if we just take the framework for evaluating services, so this comes really from Melinda Edwards' paper and the young people she worked with, where they took your welcome quality criteria and the 15 steps and then condensed it into what they felt were the key challenges. I think the thing about this is it's a framework, it's not an audit tool, and so out of this should come an audit tool, and that's what we're trying to work and develop. But there are other excellent resources for evaluating services out there, including the Ready Steady Go from Arvin Nagra and her team down at Southampton, amongst others that are specific to individual disciplines. Now, in terms of meeting this, then it's recognising where the young person fits within that service and where they're moving to. I've already mentioned that not all patients will stay within our service and they may go then to an adult service. And I can think of a young person that I know, again, saw recently who had we found it difficult to find the right medication to control the inflammation. He developed some biomechanical problems as a result and then withdrew from his work. We kept an eye on him by providing a yearly review in our central institution, but he had care locally because that was much closer to him. And it allowed us then to provide the extra things in terms of communication that really mattered to the young person. And so we helped get him back into work, helped him with physiotherapy at that time. I think, does that begin to answer your question? Was there something else you wanted me to bring out?
Okay, well, I think what you're describing is how communication was so fundamentally important for that intervention to be successful for that individual. Interestingly, you've described, well, before I move on to this, I'm going to ask Julia, are there any particular ways that your service goes about ensuring that as people are, I mean, I'm struck by the fact that what actually saved the day in the case that you've described, Nick, was bringing somebody back into
so we provided
a young person's service.
So this person was 19, so he came to our clinic that's for those aged 17 to 25, but understood that they don't need to keep coming to us, and that they could see the local services and develop the rapport in a safe and controlled environment that would then be enduring.
Okay.
And then they would withdraw from our service at the time that they felt was right. And it also then covered, those who go to university as well, who are then going to come back home.
So again, it's coming back to ensuring that communication happens with familiar people, and it's this paced, gradual transition process.
And it doesn't necessarily have to be the same person each time, but if it's the same team with the same ethos and good communication across the team, then the young person feels those values come across and that they're being heard. And so often Julia would see patients for me instead of me, but because we spoke the same language, that didn't matter, and it didn't feel as though anyone was missing out. Well, at least that's what I thought.
Julia, are there any particular examples that you want to add to that in terms of how you ensure that this communication, this positive communication, is provided for the people who are using your services and moving on to other services?
Yeah, there's a 17-year-old girl that I've got in mind who she actually wanted to have a second opinion of a diagnosis, which we supported because she felt she had questions that she wanted to be answered, and she was actually going to the adult service to ask those sort of second questions, but she felt quite nervous about going there, so I actually spent quite a lot of time in sessions sitting down and asking her what she wanted to get out of it, and almost sort of doing a practice consultation so that she had that confidence that when she went to the consultation with the adult services, she felt confident and she could ask the questions that she wanted to, and she could take on the ownership of that consultation herself. I did actually go along to the consultation with her just so there was a friendly face in the appointment, so that it sort of broke down some of that initial fear, really. And then after the appointment, we had another appointment together to sort of talk through how she felt it had gone and did she get out of the appointment. So again, it's putting the patient at the centre of the treatment and making her feel confident and giving her, reducing some of those anxieties of a new environment, really.
Thank you. And I'm struck by that, by those examples that you've given, because what's going on in my head is this is also what we've heard, not just from young people, but there are other users of rehabilitation services at any age who have also been saying, well, what we want is to be able to go to a consultation and have the opportunity to be asked, what do we want to get out of this? That my rehabilitation is about enabling me to live my life, etc., etc.
Yeah.
So my hunch is that there may be a gift that children and young people services have to offer other services, and that this is about principles that aren't just locked into something called a transition process. This is about principles of good rehabilitation that then enable good transition processes that may happen at any.
Well, we've mentioned advocacy, but it's also about self-management. It's understanding what information is out there available for them. So we understand that young people are, again, only going to remember sort of 20% of what we say in clinic. We're trying to give that level of confidence. So we provided a web-based resource then that, again, they could go back to that would help them with that understanding of what was being said in clinic. And also it's about the way that we use clinic letters to support that appointment.
So, again, going back to what Tinez said, that we're looking also about age-appropriate forms of communication. Younger people are much more likely to access a web-based resource, although that assumption can't always be made. But so you're trying to make sure that the forms of communication,
and also providing email contact, because email is a way that people like to communicate. If they feel face-to-face they can't ask something, then if there's an email or something like that, then sometimes people can write a bit more in there, so we provide email addresses.
Unfortunately, we're not keeping up with the technology, because instant messaging is probably the way forward.
Indeed.
And also, we don't patients don't necessarily access through web sites anymore. It's through apps and other resources that are constantly developing.
Yeah, Tinez, did you have any comments on that?
I think what I've always felt is the system is very stuck in the olden days. I think there is a need for innovation and it needs to be led by those providing the services. And I think the 2 points made by Nick and Julia are sort of very pertinent to what young people are seeking but aren't getting these days.
Yeah. Well, I suppose that then brings me to the list of resources here. We've got some resources here to enable people to look at some of the tools that are available to support engagement and co-design between service providers, service commissioners, and the people who are using services. And I want to ask our two providers whether you have actually engaged any of your young people in, you talked about the bullet point list that we previously had up on the slide, needing to move forward into an audit tool. Have you actually an experience of engaging young people in the process of designing an evaluation for services?
For the pain service I work with, we ask them to provide feedback, and we run sessions where they can come and feedback to us how the service is run and what their positives and maybe negatives are, so that we can then work upon that to change the service that we provide.
I think another forum for feedback was we ran classes, which provides peer support, and that I think was a learning experience we hadn't anticipated, because we thought it was a one-way information, but actually in that peer support event we got it back. And then we've also run full days of activities, again for thinking it's just about peer support, and again information has come back from us either through the young people or through their parents about how we could modify the service and what they felt was a challenge. The movement, just for instance, going from primary to secondary school through to tertiary education, they felt was a challenge, and so we just developed tools to support that.
Thank you. And so we would very much welcome colleagues listening who've got other resources to share to enable engagement for young people with speech, language and communication needs, for example. I think we could benefit from resources there in terms of accessible communication and engagement. And before we move on from engagement in co-design, I just want to turn to Tanez and say, have you got any experience in being engaged in the evaluation of service, or is there any resource that you would recommend to people?
In terms of evaluation of services, I've been involved in numerous focus groups and studies to help service providers sort of engage with their young people, because it's something that they want to do but aren't really figuring out ways of doing it. So I've been involved with that. I think in terms of helping with communication and understanding what works with communication, there's a fantastic tool that was created by Kate Martin by the Common Room, which is called Me First. You can find it online. I'm sure there'll be links to it after the webinar, and it really takes you through a step-by-step process to see how you're communicating and if you're communicating effectively. And it can be used both by the service provider and by the young person to make sure that there is effective dialogue. So it's a fantastic resource. So please do have a look.
Well, we'll make sure we get that get the link from you, Tanez, and we can make sure that that goes up on the forum. So thank you for that. Thanks to those listening who responded. We had a pre-webinar survey where we asked people their view of what the behaviours, values and actions are that make a real difference in supporting the movement of young people from children's services to adult services. We will share the wider issues that were sent in without any attribution, and we will put those on the forum, but we've summarised the main themes here. And so far, our listeners have suggested that offering services based upon need, being accountable for making things happen, and listening are very crucial to making this quality experience. You've also identified that preparing ahead, and I think that matches with what our speakers have said today, including preparing for handover and offering a key contact, are important. And there's also a cluster of themes here about flexibility, proactivity and clarity, together with planning and communicating together and managing expectations, skills and resources. So a number of themes that have come out.
But when we shouldn't forget that this isn't just about paediatric services, it's also about adult services, and it's about those who enter the service at 18 who still have exactly the same challenges.
Yeah. Absolutely. So I think as we've gone through the webinar, what we are hearing very clearly is that there are some clear principles here of good practice, which are not locked into a process, a transition from child to adult services, but that actually potentially could improve everybody's care pathway. Looking at this slide here, I now want to invite Tanez, Nick and Julia to let us know from your experience, are there any of these that jump out as the top three for you? Or would you actually choose something different to highlight as a priority, value, action or behaviour?
I think for me, I would go with clarity of process.
Yes.
Consistency across the board in terms of not just in one hospital but across the board and different services, and also communication not just with the patient and the service provider but between service providers, between hospitals, between services, because I think that's vital and I don't think it happens often enough in healthcare and social care.
Thank you very much, Tanez.
For me, is giving a key person of contact, sort of taking ownership that is your patient and seeing them through that journey, so that they feel if when they've transitioned they need to come back, they've got a way of contacting someone rather than being sort of left hanging from that cliff that they've been thrown off.
I think that's absolutely vital. I think accountability is one of those things, and I think accountability across the network. Unfortunately, networks aren't set up well in the current commissioning climate. There's lots of barriers to that, but there are ways around that, and that's what we're trying to do in the southeast. What's interesting has been quite funny is that flexibility is the smallest one, and I think flexibility is absolutely key.
Yeah, I mean, I'm hearing even in our sort of 40-odd minutes together so far today, flexibility is coming across, communication is coming across, actually relationship building is coming across.
Definitely.
You've just talked about networks, and obviously as a community improving rehabilitation services network, we are very keen that people continue this debate on the forum and build some of those relationships that actually support people perhaps feel, blocked for the moment in their innovation, blocked in their improvement, and get to share learning and good practice. It's noticeable then, I'm aware that we're getting close to the end of our time. So I think in summary then, what we're hearing is that there are principles of good quality and effectiveness here that set the context for good transitions. And that if we get these principles right in rehabilitation services, we're going to get better and more effective transitions actually across services at any age. We very much welcome your views as the listeners. Please do put your own thoughts on the forum. You have the link here to the forum. And also, if you would like to be part of the community of practice, if we don't know of you so far and you'd like to receive information directly, then please contact my colleague Catherine Andrews. So at the close of our time now, we would like to thank you very much for listening. Thanks to all of your speakers. To all of our speakers, please do give us feedback through the evaluation that will pop up for those listening live, and do keep in touch via the Improving Rehabilitation Services Forum. So it just leaves me then to thank personally to Nez, Nick and Julia and everyone for listening.